Now, today we are going to discuss clinical medicine. What is clinical medicine? It's very important for the students who are entering from the preclinical classes into clinical classes. The preclinical stuff is usually the anatomy, the histology, the physiology, the biochemistry. Some of them have pharmacology, the pathology. But when we come into the clinical medicine, we actually go into a different area of medical education. Clinical medicine is basically dealt in the hospital or clinical side of the medical complex. The medical complex or the teaching medical complex consists of a medical college or a medical school and an allied hospital where the clinical training is imparted. So clinical medicine is practiced on the clinical side. Now there is slight difference because when we come into the clinical side, we have in mind the physiological or pathological definitions. The definitions are different on the clinical sides, and we proceed in a different way in the clinical side. Now, when we go to the clinical side, what is the first thing is the health. Now, what is health? Health is a state of complete physical, mental, and social well being. That is a complete state of mental, physical, and social well being. It's not just the absence of disease or infirmity, that the disease and infirmity should be absent, but there should be uh, well-being. There should be a complete well-being. The patient should feel normal, and patient should not feel ill even mentally or socially. And you see, these individuals generally have the ability to maintain their internal milieu, that is the homeostasis inside is maintained, and they can recover from various type of insults. And then if this is health, then what is disease? Now, disease is a harmful deviation from the normal physical or functional or structural functioning of an organism. This is different from the injuries, the physical injuries. They are different. A disease is a state of abnormal structural or functional performance of an individual, and this is usually associated with certain kind of symptoms and signs. Symptoms are the uh, patient's physical problems, the complaints, whatever complaints the patient generates or the patient tells you, they are called symptoms. And what a physician or a surgeon examines the patient and find abnormalities, these are called signs. The patient has symptoms and signs. And you see, this is different from physical injuries. Now, what is a healthcare system? The healthcare system is basically composed of three main components. The one of the most important and the VIP of the healthcare system is the patient, the most important of the healthcare delivery system. So we call this as VIP of the healthcare delivery system. And then you've got healthcare establishments, and then you've got healthcare individuals who provide this health. Now, what is this healthcare establishment? Healthcare establishment is actually a place where patient gets advice about the patient's health, and it has different components. It may have inpatients, that where patients are admitted. It may have outpatients. Outpatient establishment is where patients are seen and they are disposed of with certain advices. And then you've got an emergency department. The healthcare establishments, which usually have inpatient services, they also have outpatient services and emergency services. Some of the healthcare establishments are only meant for outpatient services. They don't have an emergency service or an indoor service. But the healthcare establishments which have indoor services, they usually have outpatient services and emergency services as well. And then you've got healthcare providers. Now, who are these healthcare providers? These are different group of people which are involved in the healthcare delivery system. Now, these are the medics, that is the medical staff, which provides the direct uh, services or the medical services to the patients. For example, physicians, surgeons, or gynecologists, or a pediatricians. So this is medical staff. And then you've got a paramedical staff. We can call it a support staff, which helps in making the diagnosis and the treatment of the patient. For example, the radiologist may or the radiological technician may help the physician conduct different type of radiological investigation, and a staff nurse or a pharmacist may provide the physicians about the dispensing or disbursements of the medicine. So these are called paramedical staff or the support staff. And then you've got policymakers. Policymakers can be at the government level, which decide the overall policy that is going to prevail in the community. And then you've got policymaker, which may be related to a particular institution, that they will decide how this institution is going to function. And then you've got the administrators. Administrators are different type of staffs, which includes the admin staff, the human resource management, the financial management, the purchase department, which provides you different requirements, for example, drugs or surgical instruments which are required, or surgical disposable items which are required. So these are purchase department. And then you've got maintenance and repair section. So you've got multiple section in the administrative staff which are required for the smooth running of the hospital. So you've got different staff which have got different function, and you must know about it, because when you go into the hospitals, you are confused at what is the responsibility of what person. So you must know basically what different type of staff is available. For example, there may also be an IT department, and if you have a problem, you may have to see that information technology department. So these are different administrative or managerial staff which are present in the healthcare establishments. And then what are the objectives? Objective is, first thing is that these healthcare services provide you disease prevention. The most important tool for disease prevention is the education of the patients. This is generally done at the government level or at the community levels. The patients are educated about different type of steps which they can take to prevent the disease from occurring. For example, one of the step is we ask the patient to control his or her weight, so that can prevent multiple disease from coming too soon, for example, diabetes or hypertension or heart disease. Similarly, the lung cancer can be prevented by educating the people that they should not smoke or they should quit smoking. So this is very important strategy, which is one part of the healthcare delivery systems in almost all communities, that they resort to preventive measures. So best preventive measure is the education of the patient. And then you got these policies which are generally made at the government or individual levels, which I already told you that they can be decided by the government or by the institution. And then we got another preventive measure, which is vaccination. Vaccination is when you vaccinate an individual, it means you are going to produce a sort of defense in that individual against certain diseases. These diseases are generally infectious diseases. And then we got the second objective is, if the patient gets sick, preventive medicine is that you prevent the patient from becoming sick. So you try to keep the patient healthy. And if the patient becomes sick, the second objective is that you make a diagnosis that what this patient is suffering from. The diagnosis initially is at the anatomical level, that is what organ system is involved. Patient has got problem in the liver or in the heart or in the kidneys or in the lungs or in the bones or in the GI tract. So you make an anatomical diagnosis, and then after this you make an etiological diagnosis. And etiological diagnosis is, that is what is the cause of this disease. For example, if the patient has a liver disease, then you find out what is the cause of liver disease. So the presence of liver disease means the patient, you have made an anatomical diagnosis that the liver is involved. And then you make an etiological diagnosis. Etiological diagnosis is that this liver disease is called, for example, by chronic alcoholism or chronic hepatitis C. So that is called etiological diagnosis. And then the third objective is you manage if the patient is sick. The management can be curative. For example, if the patient has got pneumonia, you treat the pneumonia and the pneumonia is cured. And then you've got palliative treatment. The palliative treatment is that you provide a treatment which improves the patient's quality of life. The disease is not cured, but the patient's quality of life becomes better. The disease is manageable. For example, you control the blood pressure, you control the diabetes. The patient does not have the ill feelings because of diabetes. And similarly, if the patient has, for example, an advanced stage cancer and you cannot treat that cancer, you do some sort of a procedure which can help the patient quality of life to improve. For example, if problem is in the esophagus, patient cannot eat, you provide a palliative care. For example, you make a hole in the abdominal wall, you call it a gastrostomy or jejunostomy, and you feed the patient through that opening. So this is called palliative treatment. And then you can have rehabilitative treatment. Rehabilitative treatment is that if the patient has suffered from a permanent damage from a disease, then you provide the patient treatment which can help the patient to overcome that disability which is produced by the disease. For example, if there is a limb which has been lost, you can provide an artificial limb. So this is rehabilitative treatment. So the patient can be provided different type of treatments. Then how do you make a diagnosis? Diagnosis is by data acquisition. You acquire the patient's medical data. How do you acquire that data? You see, classically the first step is the history taking. In the history, we see in the patients how the patient's complaints have developed, and we through a systematic approach try to analyze what is the possible cause of this patient's illness. And then the next step is physical examination. After you have taken the history of the patient, then you go for a physical examination and you see if there are any signs or telltale marks of the disease present, you note down. And then you can do certain diagnostic procedures. For example, you can take a fluid if it is present in the peritoneum and send it for analysis, or you can do a pulmonary function testing. You can do different type of bedside procedures to find out what is the possible cause of this patient's disease. When you've got through this, you can go for investigations. So you can take the help of different type of investigations. Now, what different type of investigations we can have? We can have body specimen analysis. For example, we can analyze the blood, we can see the urine, we can see body tissues. So we can go for different type of analysis. So multiple tests can be done on blood, they can be done on body tissues, they can be done on body fluids. So we examine these in a different way and according to the needs of the patients. How we determine the need, it is actually by the patient's history, physical examination, and if any bedside procedure, if you have done that. And then the second way of investigating is that we image the patients. Now, how can we image the patient? You see, we can have electrical images. For example, we can do an ECG and see what is the conduction in the heart, or you can see the EEG, how is the conduction in the central nervous system, or you can do the nerve conduction studies. So you can have electrical information about various structure, how they're functioning. And then you've got radiological investigation, various type of X-rays, CT scans, and contrast studies can be done to see the internal structures. We can go for sonological studies, that is, we can use ultrasound for studying. Ultrasound can be the conventional ultrasound, it can be modified ultrasound like the fibroscan, which assesses the liver, and you can have another type of ultrasound which is called Doppler ultrasound, in which you can see the movement of or the flow of blood, and then you can do an echo and see what is going on inside the heart. And then you got magnetic imaging, for example, magnetic resonance imaging, in which we can see various structure of the body. And then so we can go for different type of molecular studies, and we can do the nuclear studies, in which radionuclide material is used for imaging the body. So you can see we have different type of imaging investigation. So there are two main type of investigation. We go for body specimen analysis, or we go for the imaging studies. And sometimes we go for some functional studies as well. And then when we've got that data to make a diagnosis, the third step is cognitive workup. That's we go for cognitive workup. What is the cognitive workup? Is the interpretation of acquired data to achieve the logical conclusion through steps like a provisional diagnosis or a final diagnosis. So this is the last step in making a diagnosis, that you acquire the data, you process that data in the mind, and this can be used to make a diagnosis. So this is logical interpretation of the data acquired. This is called the cognitive domain of learning, and this is usually done in the final years of medical education. And then treatment. Now the treatment can be medical treatment, it can be surgical treatment. Now what are the main differences between medical treatment and surgical treatment? What happens in medical specialties? Medical specialties means, for example, internal medicine, you've got thoracic medicine, the cardiac medicine, or the renal medicine, or the rheumatological medicine. So what we do in this is, that is the disturbed physiology or pathology, it is treated with drugs or psychological support system. So if the patient has disturbed physiology, patient has disturbed psychology, this is treated with medicine or psychological support system. While in surgical specialties, disturbed physiology or anatomy is corrected by alteration or correction in anatomy. So you either alter the anatomy or you correct the anatomy. The example of alteration in anatomy is, for example, if the patient has appendicitis, we remove the appendix. The correction of the anatomy is, for example, if the patient has obstruction in the intestine or a valvulus, you remove that portion and re-anastomose it. Or another example of this is that if there is occlusion in one of the arteries, you can remove the clot and restore the anatomy. So these are different surgical treatments. So the medical treatments are the disturbed physiology or psychology is treated by medicines or psychological support system. While in surgery, it is the alteration or correction in the anatomy which is causing disturbed physiology or which is causing disease. Now the treatment is now changing very rapidly, and there are mixing between surgeons and physicians. A lot of instrumentation is available on the side of the physicians as well. Physician used to be conventionally called that they treat the patient with medicines, but now there are many instruments available for physicians to work as well. So the treatments are now actually blurring a little bit, and as we see in the future, this might be leading to more blurring between the physicians and surgeons. Although there are extreme ends, that there some of the procedures can be done by surgeons and some of the treatments can be done by physicians only. But you see, as the technology is going to grow, this demarcation is already becoming slightly blurred, and it may blur further on.